my husband, his name was Elijah. He was Elijah Alexander. Oddly enough, he played in the NFL. So he was a NFL linebacker, played in the league 9 years, played college ball at Kansas State. And a couple of years after he retired from football, he started complaining about pain in his feet. For a while, he was going to doctors trying to figure out what was going on. A lot of them were just telling him, hey, it makes sense that you would have pain in your feet. You played football for all of these years. It's pretty common, no big deal. To be very honest with you, we almost lost him. And what prevented it going that far was he happened to be on a trip to Costa Rica with some of his friends. He got sick on the flight over to Costa Rica. His friends were so concerned that they called a physician in. That physician in Costa Rica did blood work. And that's how we found out something was very wrong. That doctor said you need to get back to the United States as soon as possible and have all of your labs done. And when he came back home, within days of that, he was diagnosed with multiple myeloma. He was at the worst stage of it. What then was considered to be stage 3B. So that meant his kidneys were impacted. He was essentially in organ failure.
How long had he been having those symptoms that he talked about in his feet before, I guess, this time?
That will always be the one thing that I'm curious about, especially because with him being an NFL linebacker, anyone who
They're
knows,
not going to tell you anything that hurts, right?
they are conditioned to ignore pain, treat it with some painkillers and keep it moving because, if you complain about pain, you're not on the field, you might lose your job. It may have been something that could have been bothering him for a while and he just thought it was something else. I really don't know. But it had only been a couple of years since he'd been retired. So it all happened pretty quickly. And I'm honestly convinced he was probably dealing with myeloma while he played because he had such an advanced form of it by the time it was caught.
This is Genetics for Healthcare, a podcast for patients.